In the spirit of reconciliation, integrated living acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today.
Hello and welcome. My name is Catherine Daly, CEO of Integrated Living Australia, a community-based health and aged care service provider. I'm thrilled to be welcoming you to our brand new platform, our Live Well podcast. As the media and digital landscape evolves, we want to be able to offer our clients, team members and listeners more broadly a new way to hear from us. Our Live Well podcast is for everyone in our Integrated Living Australia community and for anyone who loves a great story. Each edition will speak directly with Integrated Living Australia staff, our support workers, registered nurses and people from across the country and hear their stories, those on the front line who deliver exceptional care to thousands of older Australians in regional, rural and remote areas.
Welcome everyone to the Live Well podcast. Jo Isaac with you for this episode, and I'm very pleased to be joined today by one of Integrated Living's wonderful registered nurses, Fatimah. Today we'll be talking about heart disease, which sadly is the single leading cause of death in Australia, killing one Australian every 30 minutes. February marks Heart Research Month, raising money for Heart Research Australia and their work in supporting research into the prevention, diagnosis and treatment of heart disease. So this is a great time to be highlighting how we can all make simple changes to improve our heart health. Welcome, Fatimah, and thank you so much for joining me today.
Hi, very honored to be part of this podcast, and it's a nice opportunity for me to talk about our wonderful program, Wellness for Independence.
That's fantastic. We're looking forward to hearing more about it. All right, so to start, I'd really love our listeners to hear about your wonderful philosophy when it comes to caring for our seniors as a registered nurse. You mentioned to me how much you really love your job. Can you tell us why?
Okay, so I always believe that every client is special. I could not emphasize enough to all of my clients how important they are. And I always treat my clients as my pops and my nana. And they deserve the right care, respect, and love that we should shower our own family. So I always look at them more than just their medical background or medical history. When I am looking at them, I always tell myself, they are someone else's loved one. They are someone else's pops, dad, uncle, brother, son, nana, mom, auntie, sister, the list goes on. And, being a registered nurse, it's more than just possessing the clinical knowledge and technical skills. It is having the heart to serve and to care and to be an advocate, especially to those who are vulnerable, like the many pops and nuns we have in our community.
Well, that is so lovely to hear. And can you tell us just a little bit about your one of your Wellness for Independence groups? You call themselves Fatimah's Fabulous Family. Can you tell us a little bit about how that came to be?
Yes, so I started running this group early last year. They're actually from Central West and around the Far West. I haven't met them. We only met each other through, Zoom. So they enjoy the program that we run. And then they just keep on asking me even before the program has ended, hey, Fatimah, what are we running next? What are we running next? So we called ourselves Fatimah's Fabulous Family. And it's actually very humbling, like how I see how happy they are, at the start of the program. They're just catching up. They're just like old friends, like they know each other since probably they were young. And it's actually amazing how I became an instrument for that. And for me, that actually is more than enough to tell myself, yep, you're on the right call. you're on the right profession. It's right. You are actually touching and changing lives. It's more than enough. It's very rewarding.
That's wonderful. And I'm sure your fabulous Fatimah's family are very lucky to have you running all these programs and just enriching their lives as you do so well. So thank you on behalf of everyone. Our wonderful nurses have really been so instrumental over the last 2 years. And of course, they always were and always will be. But our nurses have made such a difference to people's lives during the pandemic. And I'm sure I speak for everybody saying thank you to you too.
Oh, that's actually nice. I remember now, my fabulous family said, we are like, families are like trees. Like we could have different branches, but with just one root. That's what we always say. And I was like, oh, that's really nice. And doing this job made me, and meeting these people makes me want to become a better nurse, work harder and be happier. It's like I said, it's a very rewarding profession, and it's very humbling. And for me, seeing them smile, making a small difference, it lasts, like the effect lasts forever. You think about it and you smile and you bring positivity and happiness to not just them, but for anyone. Yeah. So I'm very honored to be part of this company, actually, and I'm being able to do this job as well.
Oh, that's wonderful, Fatimah. Thank you so much. Well, let's moving on to our heart health, which is so important at every stage of our life, of course, but especially as we're getting older. And as a facilitator of our Wellness for Independence programs, our cardiac wellness program in particular, can you tell me a little bit more about heart disease? What are the key heart conditions people may develop?
So heart is actually a very vital organ in our body. One of its main function is to ensure that blood is actually pumped or delivered to every organs in the body. So blood actually carries oxygen and nutrients that our organs need for it to function properly. As what you have mentioned earlier in your opening statement, heart disease is the single leading cause of death in Australia, and one Australian every 30 minutes died from it. Actually, according to the World Health Foundation, 80% of the deaths associated with coronary vascular diseases are preventable. So some of the key heart conditions that people may develop are angina, heart attack, arrhythmias, and heart failure.
Well, yes, and I mean, it's great to hear that whilst heart disease can be so dangerous, that there's so many things we can do to prevent it. So that's a really important note as we go on and talk about it. Can you tell our listeners what they need to know about heart attacks? What are the signs of a heart attack, and what should someone do if they or a loved one are displaying any of these signs?
Heart attack is a sudden and complete blockage of blood vessel. As we know, I always tell my patients when I do the classes, blood vessels are like bridges and roads, and that's where the blood would usually pass through. In that way, it would reach all of the other parts of the body. So during heart attack, these are somehow blocked. So when it's blocked, as you know, blood cannot reach the organs, which we know blood is very vital for all of them to function properly. So when there is a blockage to the heart or some part of it, what happens is it becomes starved of oxygen. And when there's starvation of oxygen, that part of the heart becomes damaged or even dead. There's a couple of signs of heart attack. It can vary from people to people. It's more than just, the chest, the clutching and the chest that we normally see in dramas and movies. Actually, it can be manifested in many ways, and each patient is always different. But these are some of the I'll not say common, but these are some of the signs that are associated with a heart attack. Of course, as mentioned, the clutching of the chest, because it means that there's a chest pain. And it's like someone or something heavy is on it, and it doesn't actually go away with resting. The other thing too, it actually radiates. The pain radiates from the chest all the way to the jaw or to the arm. Some people don't have that, but they could have stomachache, like indigestion stomachache. Other people would just feel tired, like, oh, I'm just unusually tired than usual. Or nausea. They're like, I feel like vomiting. What's this? I don't know what's happening. The other thing as well is they could develop shortness of breathing, like, like they couldn't breathe. Weakness is also another thing. And sometimes they become sweaty and they also become dizzy. The best advice I always tell my patient or my client when they experience something like this, I always tell them, call 000. I know for a fact some of my very lovely, beautiful nanas and pops in the community would tell me, but Fatima, what if it's not heart attack? What if it's nothing? I'm actually taking away the time from someone else who needed it. And I'm like, hey, man, pops, you are important. In fact, you're the most important person in this room. You are as important as anyone else. So if unwell or not sure if it's a heart attack, just call 000, call the ambulance. And remember, the quicker that we're able to access the treatment, the better our chances of preventing the damage to the heart muscles and the heart itself.
That is such important advice because yes, it's a very Australian thing not to want to cause a bother to anybody, isn't it? But it's the difference. It can be the difference between life and death to make that call. So yeah, great advice. Thank you, Fatimah. Can you tell us what are some of the risk factors that increase people's chances of developing heart conditions?
In our cardiac wellness for independence class, we always talk about two types of factors. We have what we call the non-modifiable one, and we also have what we call the modifiable one. Non-modifiable ones, these are the ones that are actually we can't do anything. An example for that one is gender. Apparently, men are on a higher chances of having heart attack and heart diseases. Women actually also have that chance after they have their menopause. Another thing, family history. If you have family history of heart diseases in your family or in your genes or your ancestors and things like that, if both of the history is from both mom and dad, you're 50% higher of developing heart diseases. Diabetes, same thing. Diabetes is also another thing. If you have family history of diabetes, high cholesterol, high blood pressure, you're also at risk of developing heart diseases. Age actually is also another thing. As we grow older, there's always physiological changes in our body. That also includes our heart. So as we grow younger, I always wink on that on my patient and they laugh about that. I'm like, oh no, as we grow younger, wink, our body develops changes. And so that also makes us at risk for developing heart diseases. That's for the non-modifiable one. So that's the thing we cannot change. Oh, and there's also one more thing. Some nationality and like our Aboriginal and Torres Strait Islander, they're actually 20% more likely to have heart diseases, and some ethnicity like Middle Eastern people, Asian people, they're also at higher risk of developing heart diseases.
Right.
So modifiable risk, like mentioned, these are the one that you can actually do something. We can do something on this one. So smoking. People who smoke, they have 20 times likely to have a heart attack. Yes, we try to reduce, if not quit. There's a lot of programs available that our government is actually encouraging us. Speak to your GPs, speak to your RNs, or ask what you can do to start the process. Best advice I always say is, just try to start. Like, once you try to start, at least you try. That means that you wanted to change.
Yes.
Alcohol as well. That's also another thing. Obesity is another thing. So when you are you're obese, you get excess weight. And then when you have excess weight, that actually increases as well your chance of developing heart diseases. Poor diet, fat, salt, sugar, cholesterol can also increases your heart diseases. Also physical inactivity. So when you're not active, you gain weight. And as mentioned a while ago, when you gain weight, you also increases your chance of developing diabetes and all the other condition. Stress actually also plays another thing. And unrelieved stress actually may damage your arteries and worsen the risk factors.
So there's so many things that's really important to do, obviously, but it's more of the better you are holistically, the way you treat yourself holistically, including your mental health, is really important in reducing your risk factors. So points to the need to learn mindfulness and trying to reduce stress in your life, which is so important. Can you also tell me, Fatimah, what are some of you've talked about risk factors. What are some simple things people, particularly those over the age of 65, can do to prevent heart conditions from developing or improve their existing heart conditions?
We can do exercise. We try to encourage exercise. In fact, they say moderate type of exercise, 30 minutes for 5 times a week, can actually reduce your risk of heart diseases. Proper diet. No more Mackets, no more KFC, no more salami, no more deli thingies in the supermarket. Try to avoid that one. Also, quit smoking. Like if not quit, lessen, because it's not easy to quit. It's actually a hard thing, and I would understand. That's why try to make the first step. Acknowledge that you wanted to quit, and that would actually make a big difference.
Yeah.
Also, lessen alcohol intake. That's another thing we can do. Reduce stress. Join activities like, we have lots of wonderful programs in our company, the Mind and Wellness program, or do social group, do Tai Chi, do chair yoga, which actually we are actually doing for our wellness gym, which is very nice, very popular among our clients actually. Also, have a regular GP review. That's what I always emphasize, and I could not emphasize this enough. I always tell my patient, always make sure that you get checked. You see, and they were like, oh, no, it's okay. I'm like, nah, you are important, remember? And because you're important, we have to make sure that you get checked. Yes. And make sure that your medication is still also up to date. I also tell them it is important that if they're on a medication, they need to take them. And if they have questions, ask the GP. There's no one that could explain it better than their own GP. So yes. I know for a fact some of our clients would be like, oh, I'm a bit shy to ask. And I always tell them, remember, you're special. You need to ask.
Absolutely. And when you say regular check-ins with the GP, how often would you recommend that?
For people who doesn't have 6 months, like, have a heart check, blood test, do check your cholesterol, your levels and everything.
Yes.
But for people who have like an existing heart condition or are actually inclined because of, let's say, some factors that we mentioned a while ago, I would encourage, if not monthly, every 3rd month, at least, you can do a bit of a whole blood test, whole profile on what's going on. With our elderly clients, they can actually change in a snap. That's the thing. That's why we have to be very careful when we're looking after them, because they're very vulnerable. And it comes with all the other things also occurring in their body. As we grow younger, wink, wink, physiological changes, so we can't change it. So that's the thing. We have to be very keen and very religious in monitoring them. And that way we can actually catch if they have anything that's starting to develop and prevent farther damage or farther after effects that I know could really be debilitating to them. We want to support them to stay longer in their homes. That's where they're happy.
Exactly. And can you tell us how our Integrated Living's registered nurses can help our clients? How can accessing the services of in-home registered nurses and in-home telehealth, how can that help you as you grow older to ensure that you're getting checked when you need to, and not everyone's going to go to their doctor often people go when they're not feeling well rather than as a preventative measure. So how can our nurses and telehealth programs help keep that in check?
Yeah, actually, that's what I was saying. Integrated Living has lots of programs available actually that our elderly clients can actually access. As you mentioned, we have registered nurses like myself. We usually come and visit them every month or every 3 months or every 2 weeks or how often they needed. Registered nurses would monitor their blood pressure, would monitor their weight, would do clinical assessments. And if there's anything outside the range, we would actually talk to their doctors about this one and express the concern and be an advocate in behalf of our clients. Telehealth monitoring is also nice. I actually was a telehealth nurse as well in the company. I still do a little bit from time to time, but how it works is that this is really great for people who are living remotely and they needed, let's say, monthly or not monthly, weekly or daily blood pressure monitoring or sugar level monitoring or weight monitoring, especially for people who have heart condition that they are at risk of developing fluid overload. So the best way to actually know if this client is retaining fluid, mind you, is weighing them. It's more than just watching for fluid like edema in the the best way that we can actually say, hey, she is retaining or he's retaining is actually to do their weight. So telehealth monitoring can do that. Saturation, temperature, weight, as mentioned a while ago, blood pressure, sugar level. And you don't have to actually leave your house. You're just in the comforts of your home. And once you've taken your vitals, it will be actually sent to a registered nurse like myself. We have a very great telehealth team, by the way. I would say shout out to Sam Bamford and her team.
That's awesome.
So if there's anything that is outside the parameters that we have set up with the GP initially before they started this telehealth program, we would call our clients, we would alert their GP that, hey, this has been happening, this is the trend. And the GP can actually say, oh, all right, so the report is there, numbers are there, concrete evidence and data that would actually tell the GP, all right, I need to review you. I need to check your meds. It's not working anymore. Maybe adjust the dose.
That's fantastic. And a lot of people don't know about that. The service you can get through in-home care that gives you that peace of mind as you age, that you're having someone regularly, proactively help you keep on top of anything that might be happening. And it must be a great relief for people to have that support, which is wonderful. All right. So let's talk about Integrated Living's Wellness for Independence programs. There's obviously, we've talked about the cardiac wellness program, but there are a whole range of programs that we do. How can people benefit from these, and what will someone learn if they take part in the cardiac wellness program in particular?
Yeah, so like you mentioned, there's plenty. I've run a couple of them. Nutrition program that actually also encourages them to be a bit more mindful in what they're going to eat, learn more about how to read labels, how to cook healthy, even, proper storage of food, proper cooking for food. That's actually something they can learn, and it's amazing. We have the falls. We also have the low vision. We also have the diabetes program. We have the memory program. I love that as well. We have actually mind and body program, which is very nice. I'm excited to run that. We have the respiratory program, which is actually very timely, knowing that it's COVID and COVID is that will always, I think, will be here at the moment. And we just have to actually learn how to make sure that we prevent this from happening to us. So that we have a respiratory program for that. And then we have the cardiac. What are the benefits that our clients can get from joining the Wellness for Independence program? Aside from getting an iPad with a free internet, that's actually amazing. And also a watch that would count your steps and your sleep. You also get to learn lots of things. You get to learn, let's say you're doing cardiac, you get to learn about the heart, about the importance of regular checks. What are the things we need to watch out for? What are cardiac diseases? What is the function of the heart? Better understanding. In that way, you'll be able to make good decisions and be a bit proactive in living healthy. And when you're living healthy, we are actually encouraging them to stay longer at home, which, like I said, they love that more than anything in the world. This program's actually encouraging our clients to be a bit more wise with how they want to live their life, how to improve their health, how to prevent things that can be prevented. They gain knowledge too, and they get to meet new people. And socialization during COVID, they need that. And especially during those times when we have the lockdown, my clients always look forward for their classes. And they would come early, talk about their gardens, about their new pets, or about their flowers, or about anything. And that's actually very nice for their well-being. Even if they are far from each other, they're not lonely, they're not isolated, because we have programs such as this one that brings people, not physically, but virtually, but it's the same thing. Feel good emotion is the same. And that's why this program is really, really good. And I would encourage everyone to actually be a part of this.
They are fantastic programs. As you often send photos of your Zoom of everyone smiling and looking so happy, and it's very heartwarming to see our seniors come together in this new way, and even learning how to use an iPad and how to which then brings them connection, not just to the programs but to their families and their friends. And it's such a so many seniors have really upskilled in terms of technology over the past 2 years, just because they've had to, but also that's opened many new doors for them, which is fantastic, isn't it? So with the iPad and the connection, is that theirs to keep, or is that do they borrow it for the duration of the program?
So the iPads and the internet is actually, they're loaned to them during the time that they are joining the program. By the way, I forgot to mention, we do have what we call the digital program as well, where we actually teach our clients about how to use the iPad, the ins and out of the iPads, the apps that they can actually use. One of the favorite apps that I actually teach them is Libby. It's like an audiobook app. You can be connected to your library and you can borrow audiobooks, and it doesn't cost you anything. And for my client who loves to read, she said to me, thank you, because she sees her eyes are fading and it's hard for her to read, a hardbound copy book.
Yes.
So I said to her, what about you try Libby? You can just listen to it and it doesn't cost you anything. And you can borrow it from your local library. Like you can borrow the books available in your local library. And as you know, it's endless choices for them. So she was happy with that. So very amazing program. Like I said, I can speak probably and talk about this
endlessly.
I love this program actually, and it's true, I do.
That's wonderful. So on that note, can you tell us about some of the positive health and wellbeing outcomes for your participants, people who've done the programs? Any favourite stories to share? I guess you've just shared the one about your client who loves to read, and this gives her that way in. Any others that you'd like to share?
Yes, I have a lady. She was not too techie. At the beginning of the program, she didn't have an iPhone. She didn't have anything like a smartphone. She'll have the telephone, the normal line. So one day I was surprised before I start the program. She was like, Fatimah, thank you. I'm like, yes, my love, what's wrong? She said, I bought myself a new iPhone and now I can scan the QR code. I don't have to write my name when I enter the facilities. I'm like, oh, good on you. And she said, well, I realized it's the same as your iPad. So I bought myself a new iPhone. I'm like, oh, wow, good on you. So that's one of the things. So she was able to, now she knows how to Zoom. She Zooms her daughter, by the way. The daughter is, I think, in Canberra, another state. So she Zooms her every day or, every week. And it's actually amazing. You see, our program, it actually bridges the gap. Our older generation, they're not born techie. No. But this program is encouraging them and letting them see that, hey, it's okay. Even if you're a bit young, wink, wink, still learn new things. And I always tell my clients, you should give yourself a pat, because look at you guys, how amazing you guys have been. You now know how to download apps, use Zoom, watch Netflix, open YouTube. Really? Do Spotify. That's so nice. And I'm so proud of them. I'm like a mother hen. So proud of my chicks.
Well, obviously they must just adore you. So it's wonderful to hear these stories. And finally, Fatimah, how can people take part in the Wellness for Independence programs? How is it funded? How do they get in touch? All of those things.
It's actually in our website. We have the Wellness for Independence program, different types of programs in there. We have actually reached out to GP practices. We've left some of our flyers. So Sometimes they could probably hear it from, let's say, we run like Chris, my wellness lead. She runs like information about the Wellness for Independence program. She liaises with local GPs, hospitals. We also go to like places like Mention. I remember going to a Mention, going to bowling clubs, and like looking for 65 years old and above, or let's say crafts group. We have nurses like myself. We usually go and disseminate information to them. So if they are interested, they can call Integrated Living number, and then they would be directed to a registered nurse like myself or anyone around the area. So how they can get funded? We actually do a 3-way phone call with my aged care, and we request for a nursing CHSP referral or an SSS other code, whichever is available in their area, because some areas don't have nursing code. Instead, they're using SSS other. Once they've been referred and they've been approved for a nursing CHSP or an SSS other funding, then they can join the program. And actually, it doesn't have an expiration to some of them, as long as it's active. Some of them, some of the referral has don't have any expiration. So that's amazing. They can join as much program as they want, and that's I think what my groups are doing now. I have 5 groups, and they're all rolling over, and I love them. They're not getting what you call the one lesser. They're getting more. I am actually gonna be running more groups, 6-7 groups soon. So wow.
Yeah,
I'm very
that's amazing. So the people come, they meet each other, they get to know each other, and then they do each of the Wellness for Independence programs one after the other. That's amazing.
Exactly.
So really, as long as someone has CHSP or home care package funding, they can do the program.
For the home care package funding, if they're on a level 1 and 2, we normally ask and liaise with the CM, the case manager, to do an SPR, to request for an additional top-up, to do an additional CHSP nursing top-up. In that way, it's the same. Like they can still access, CHSP nursing, and it will not be taken out of their package. Level 1s and level 2 have only certain amount of funding in their in their packages. Yes. So access that. So CM will arrange that. If they're on a higher package, let's say level 3 and level 4, we can also have to liaise to the CM, because the CM, the case managers, they're the one who knows the budget. So if there's plenty of budgets, they can actually they can join the program. Yes.
So the best thing would be for someone to ring Integrated Living on 1300 782 896, and the lovely friendly customer service officer who answers the phone can help them figure all that out and point them in the right direction, help them get what they need in order to join the programs, which is great. And our website is www.integratedliving.org.au for those who want to look there and have a look and see all the Wellness for Independence programs that are available at the moment, with more coming soon, I believe. So that's fantastic. Fatimah, thank you so much for joining us on our Live Well podcast today. It's just wonderful to hear the passion you have for nursing and the difference you make to people's lives every day. Our listeners will no doubt appreciate the great information you've shared on how we can keep our precious hearts as healthy as possible. Of course, if any of you listening have any concerns about your heart, you should speak to your general practitioner or medical specialist. And tune in to the Live Well podcast for more inspiring stories of older Australians living in regional, rural and remote communities, and of course the wonderful people like Fatimah who support them. You can also follow Integrated Living on Facebook and Instagram, and enjoy our Live Well blog by visiting our website integratedliving.org.au. Until next time, bye for now. Thanks for listening.
If you, a family member or friend, is interested in learning more about Integrated Living Australia's services, head to our website at www.integratedliving.org.au or call us on 1300 782 896 or follow us on social media by searching Integrated Living Australia. We look forward to you joining us for the next episode of the Live Well podcast.